guys, and welcome back to my channel. My name is Swanson, and today I'm going to be talking about a 7-month third trimester update on how me and my little baby are doing. So, first off, I am out of breath. So let me get your breath. So right now, currently, I'm 29 weeks and 2 days. And I'm in my third trimester. I've gotten pretty substantially large, I feel like. And I had an ultrasound last Friday, and our little baby girl is weighing in at 2.8 ounces and measuring perfectly for her gestational age. So our due date is October 11th, and basically what I've been doing is kind of preparing for the arrival of our newest family members. So right now I'm in her nursery. We've gotten some stuff up, shelving, pictures, and the baby monitor from Owlette, which I'm really excited about, and I will do a nursery tour definitely in one of my next videos. We have a very tiny room that we're working with and little wall space, so it's interesting how we're going to make everything work and still kind of playing around with where things are going to go and everything like that. As far as my symptoms, I haven't suffered any kind of, not in the first trimester, second trimester, or now, any real morning sickness, nausea. I had one bout with it, but I'm lucky in that way. What I am experiencing a lot of is SPD, the pelvic girdle pain. Basically, when your ligaments are stretching and loosening up. I don't know, it's it hurts. It hurts to move in the bed, to roll over, walk around. But I have a really good belly band that I use when I'm going to do a lot of walking, which takes the pressure off my pelvis. So that's been helpful. I have been suffering a little bit from insomnia. But from what I've read, it's just going to get worse from here. So I might as well learn what it's like to not be able to sleep. What else? Definitely my focus is a little bit different than normal. All I can think about is getting ready for the baby, preparing myself for labor, what things do I need for the first few weeks. What things does she need? My mind is baby, 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 nothing else. Which it's annoying because I am going to school as well. So instead of doing my schoolwork, I really just want to make more lists and check things off lists and get things ready. But it's life still has to go on even though I'm pregnant, so I can't focus all the time that I want on just this, but it's exciting. I'm so excited. I plan on trying for as unmedicated of a birth as I possibly can. I do have complications. If you've watched any of my other videos, I've got the pretty large fibroids. From what I've researched about my fibroids, though, I feel like they're in a position where it should not affect me having a natural birth. Or I don't even mean vaginal birth, because I don't want to. Any birth is natural. I just want to do it the most old-fashioned way as possible, because I've heard the recovery is so much better vaginally, and the epidural, I don't know why, but it's always freaked me the F out. I don't know, like when I was a baby I had to get a spinal tap, and though I don't remember it, I feel like I am still scarred from it because my family would tell me stories about it, and I get weirded out people touching my back, like I cannot imagine, and I just feel like I have the worst luck, so I'd be the person who got an injury from sticking a needle into my vertebrae, or like between them, so I'm okay. I'm not opposed to it if the pain is excruciating, but I have been reading a lot of literature on like getting into a mind state for natural birth. One book that I really like is Ina May's like Guide to Childbirth, and it really like focuses on taking the fear out of it, out of the unknown, and focusing on what your body like was meant to do, and like hopefully that works for me. I mean, whatever, we'll see with my update on that, but I'm hoping that's how it goes, because I just, with all the other things going on inside my uterus, I'd rather it just be an unmedicated vaginal get her done type birth and move on with life. So that's what I'm planning on that. What are some other life updates? I'm planning on trying to exclusively breastfeed. I'm not putting a lot of pressure on myself. I know that a lot of women struggle with producing a steady milk flow, so if it doesn't happen for me, fine, whatever, but that's the plan. I have noticed that I am leaking already, so hopefully that's a good sign. It's a bit awkward, but I mean, whatever, it's our bodies. So we did not get to have a baby shower because of all the complications with my uterus. So we kind of have just been like buying stuff off our own registry like every couple weeks. And so once we have I think we basically have all the baby gear. I'm pretty sure that I'm tapped out on clothing. Like, I'm not buying any more clothing. I don't understand newborn versus 0 to 3 months versus like 0 to 6 months, and I'm just like, she's got enough clothes, so we're not buying any more clothes. But I want to do kind of like a baby gear haul once we've got everything all set in here, and so I will definitely update a video with that. Sorry, there's like, I don't know if you can hear that, but it sounds like there's like, you know, like when there's a bomb in a movie. It wasn't a bomb. Some things that I want to prepare for are getting our dogs acclimated to more noise and chaos in the house. I'm not really too worried about our 2 dogs with the baby just because they are so small. I feel like they'll be fine. But I could be wrong, because honestly my dogs do not like children. I'm just hoping because it'll be their child, it'll be fine. So basically, I'm just rambling on, so cool. Thank you so much for sitting with me and getting through my rambling. If you have any videos that you want to see about our pregnancy or any questions for me about anything, leave them in the comments below, like, subscribe, and I will see you in my next video.